Today I want to talk about cervical cancer. Cervical cancer is one of the common cancers in women all over the world and also in India. Unfortunately, it is diagnosed in late stages because the women are not aware of the symptoms which could be causing the cervical cancer. The common symptoms of cervical cancer is abnormal bleeding. So what is normal bleeding? 24 days to 35 days, once in 24 to 35 days period is normal. In between the periods, if there is any bleeding, that is not normal. That could be a sign of a cervical cancer. So any bleeding which happens in between the periods and also any bleeding which happens after an intercourse can be an early symptom of cervical cancer. Also, in the women who have attained their menopause, that is, who have finished their periods, elderly women, suddenly if there is any bleeding which starts, also can be a grave sign of cervical cancer. And not to forget the bleeding which is very prolonged. You are getting the monthly periods, but then it goes on and there is this intermenstrual spotting, can be an early sign too. So beware of these bleeding which is abnormal. Apart from that, any white discharge per vaginum which is very foul smelling, which is watery and which can be sometimes mixed with blood can be a sign of a cervical growth or a cancer. So this is a cervix. So this is from here, there is a growth which is occurring which can cause the bleeding in between the periods, bleeding after intercourse, abnormal watery discharge, abnormal foul smelling blood stained discharge and also bleeding after menopause. If you have these symptoms, you have to go to the doctor and get yourself checked. Thank you.
Hello, doctor.